Morning Hand Hygiene. Hi, my name is Kaylee. I'm going to be your student nurse today. Can I confirm your name and date of birth, please?
Mitchell Harper, August 26, 1997.
I confirm on your record you're Mitchell Harper, August 26, 1997. And I'm just going to check on your wristband, and that's correct. I'm just coming in to do a cardiac and lung assessment on you today in peripheral vascular, so just checking your circulation. I just have a few questions for you first. Is that okay?
Yep.
Okay. First, have you been experiencing any shortness of breath, difficulty breathing?
No.
Have you experienced any pain or chest pain?
No.
Okay, and then have you noticed any abnormal swelling that is more excessive?
No.
Recently? Okay. So first I'm going to be inspecting, so I'll be looking, feeling, and then listening with my stethoscope for the assessments. Is this okay?
Okay.
Okay. So can I have you scoot a little more this way? Okay, so starting with your chest for the cardiac assessment, I'm just going to be palpating. So I'll be feeling for the valve sites, so the aortic, pulmonic, the Erb's point, thoracic, and then mitral. No palpations. And then I'm just going to have you sit forward, please. Palpating the back. Are you feeling any tenderness?
Nope.
Okay, and there's no lumps. Okay, I'll have you sit back. No irregular hair pattern. And then I'm just going to be listening, starting with your chest. So there's no irregular heart sounds. And then listening to the apical pulse for 60 seconds. And I'm just going to be listening to your breath sounds. So when I'm listening, I'll have you take a deep breath in through your mouth and then exhale through your mouth. Okay, I'll have you take a breath in through your mouth. Okay, and then I'll have you sit forward so I can listen to your lungs from the posterior side. And then, let's see. Do you mind facing the wall so that we're able to see you on the posterior side? Okay, thank take a deep breath in through your mouth. Okay, you can sit back again. And then I just have to listen one more time to your valve sounds with the bell end of my stethoscope. Just to listen for any irregularities. Now I'm going to move on to the peripheral vascular part of the assessment, so I'll just be checking, inspecting, and feeling your upper extremities and your lower extremities. So starting with your upper extremities, I'm just going to be inspecting regular hair pattern, skin is pink and symmetrical, and then I'll just be feeling no edema or enlarged lymph nodes. And can I see your hands? Capillary refills less than 2 seconds with no clubbing. And then symmetrical capillary refills less than 2 seconds with no clubbing. And then I'm just going to check your radial pulse on both sides. And then I'm just going to move the camera closer for the radial pulse because I have to be able to see it. So checking the radial pulse bilaterally, +2, and regular bilaterally. Skin is pink and warm. And then I'm just going to be checking your legs. Is it okay if I take off your socks?
Mm-hmm.
No edema, regular hair pattern. I'm just going to be checking the capillary refills on your toes. Less than 2 seconds bilaterally. Checking for the popliteal pulse on the back of your knee. And then grading the posterior fibule. +2 bilaterally. And then the dorsalis pedis pulse. +2 bilaterally as well. Hair pattern is symmetrical and even. Skin is also pink and warm. And then the last thing that I need to do is have you stand up so that I can check your venous patterns on your legs. No irregular venous patterns. Okay, you can sit back down. So that is all of the assessment. Do you have any questions for me?
No.
Okay. I'm now going to just read off of the documentation that I have. Patient denies any shortness of breath or pain, denies any swelling in lungs or feet. Patient denies any dizziness or palpitations. Respiratory, inspected chest symmetry. And then, really quick, I did need to still check your APT ratio, which is 1 to 2. Regular rhythm, no labored breathing. Skin anterior and posterior is pink and warm, no tenderness or lumps palpable. Breath sounds were clear bilaterally, no wheezes or crackles. For cardiac, no lifts, heaves, or thrusts were inspectable, no thrills were palpable. The PMI was at the 5th intercostal space. Regular heart sounds in the aortic, pulmonic, Erb's point, tricuspid, and mitral valve. S1 and S2 were normal with no murmurs. Apical pulse for 1 minute was 61 beats per minute with regular rhythm. Upper extremities were pink, symmetrical, warm, nails were clean and groomed, no clubbing, with capillary refill less than 2 seconds. No edema was noted. Radial pulse was +2 bilaterally. Lower extremities were pink and warm with even hair distribution, regular venous pattern, and symmetrical. Temperature was warm with no edema, less than 2-second capillary refill. Posterior tibial and dorsalis pedis were 2+ bilaterally, with normal cardiac, respiratory, and vascular findings. And I will perform hand hygiene. No